Peggy's a typical patient that presents to my office for facial rejuvenation surgery. She's 61 years of age and her major concerns are related to the flattening of her cheeks, as we can see here, the fullness that occurs in the jowl region, and the loss of her jawline and the loss of her cervical mental angle. What I will typically do in this situation is use a variety of operative techniques to achieve the appropriate contours to the face. In this particular instance, I will use a malar lift to restore the fullness in the cheeks. I will use the 1444 laser to contour the jowls. I will use an open neck approach to contour the neck and the jawline, and then I will borrow some of the fat from the neck to put into pre-jowl sulcus. Now, Peggy does have a unique finding in that she has a congenital seventh nerve palsy. Show me your teeth, Peggy. As you can see, Peggy has a congenital absence of the depressor function in her right face. This is from a congenital seventh nerve palsy. The platysma muscle appears to be present, but it certainly isn't as strong as the opposite side, which will give us some interesting findings intraoperatively. You can relax now. Because of this congenital asymmetry, we find asymmetry in the soft tissue with greater ptosis of the jowl, more fullness in the right than the left side of the face. We also have more fullness in the right neck than the left neck. Because of this, I will utilize different energy settings in the AccuSculpt 1444 laser. I will give an energy setting in the neighborhood of 600 to 800 joules in the right cheek and 400 joules in the left cheek. And this determination for the exact amount of energy will be made intraoperatively. I will also put an additional amount of fat in the right, a little greater than the contralateral side on the left. One of the tools I've used to really refine my results has involved using the 1444 nanometer AccuLift laser in the face. Both the wavelength and the very short pulse duration of less than 100 microseconds creates thermal confinement. The heat spread is very focal and controlled. Looking at the absorption chart for both fat and water, we see that at 1444 nanometers, the absorption is magnitudes higher when compared to the many other wavelengths. The results of this combination treatment are quite striking. In this particular patient, you can see good elevation in the malar fat pad, transition to the chin, and a nice neck that's been created with the open neck approach. There are 4 areas that I have found the AccuSculpt laser to be particularly effective. In particular, I've been reducing the nasolabial folds, effectively creating a nice transition from the lip to the cheek. I've also been utilizing it for reduction in the marionette lines in the perioral rhytids with subcision and release prior to injection of the perioral fat. In this particular patient, the marionette lines have been released, the perioral lines reduced, and then fat injected to create a nice smooth transition at the commissure. This patient exhibits an example of both of those approaches with reduction in the jowl and release of the marionette lines, creating a nice smooth jawline. The patient you are now looking at has been treated successfully with subcision of her perioral lines. In addition, we utilize the fractionated ECO2 laser at the same time, effectively and safely reducing the lines around her mouth as well as in the pre-jowl region. One area I have found the laser to be particularly effective is a reduction of the perioral fat that was previously recalcitrant to our treatment. In this particular patient, she has fullness in the premodiolus area that is difficult to treat otherwise. In the postoperative picture, you see the reduction in the fat with sculpting using the 1444 laser that creates a nice smooth transition from her jaw to her cheek with reduction in the perioral fat irregularities. The transition from the malar fat pad into the jowl region can be smoothly achieved using the AccuSculpt laser, and this particular patient who has an amorphic type appearance in this midface has been effectively sculpted by reducing the fat along the jawline, extending into the malar prominence, creating a nice smooth transition. In this final result, I'll show you the example of utilizing an open neck approach and utilizing the AccuLift procedure to achieve a strong jawline. Utilizing the laser, we have reduced the fat in the jowl region. In addition, the pre-parotid fat has been reduced, reducing the overall appearance of the width of the lower third of his face. These are just a few examples of patients I've utilized the AccuSculpt laser with safely over the last year. Now my first lines will mark the deep creases that are emanating from the corner of the mouth, the marionette lines, and this is the pre-jowl space. The lines themselves, I will use the AccuSculpt 1444 laser for subcision to release the wrinkles from the deep muscle. I will then mark the areas that I will do the fat injection to give a transition from the menton to the pre-sagittal jawline. Now, when I do the lift, the jowl itself is going to elevate some, so I like to give some guesstimation of where the malar lift is going to be before I draw my jawline, which will be in this area as such, which will then allow me to mark the jowl that extends below the neck that I will use as a direct excision. Prior to direct excision, though, I will use a Coleman technique to harvest fat, which will then be placed in the back table for separation and use at the end of the case. The jowl that will not lift appropriately, you can see even with an extensive malar lift, you're still left with this fullness in the jowl region. What I have found in my experience over the last year and over 100 cases is the 1444 laser, the AccuSculpt laser, has such a small tip, a 600 micron, that I can lipolyze the fat within this area, and I can get either skin shrinkage or accommodation of skin. In either regard, what we're finding is sculpting and changes of the shape of the jawline, which gives a transition from the lifted malar pad to the recreated jawline to the sculpted neck. And then the fat will fix the deeper marionette lines and aid in the transition to the chin. You can see the lines on this side are going to be a little fuller with the transition into the cheek and the jaw here. As we compare to the opposite side, you can see it's much flatter on this side because of the seventh nerve palsy. And we can see the deep lines will be injected here after subcision with the laser, and then the laser on the left side will have less energy than the right side because of the congenital asymmetry.
Local anesthesia is achieved with a limited injection of 0.25% lidocaine containing epinephrine. We are conservative with the volume of injection due to the absorption of the laser energy at 1444 nanometer wavelength by water. The total volume is 6 to 10 cc for the entire jowl and pre-jowl region. This will assist in a more efficient absorption of laser energy by fat and therefore a more accurate sculpting of the soft tissue. The laser is set at a pulse rate of 40 Hz with a pulse energy of 175 millijoules and power of 7 watts. The total energy is typical 400 to 600 joules per side, with the endpoint determined by palpable tissue response. The laser fiber is passed into the subcutaneous plane just below the dermis. Using 140 millijoules at 7 watts, the 600 micron laser tip is passed into the subcutaneous plan over the jowls, delivering the laser energy in a grid-like fashion. The tip is passed just below the dermis to subside and release the marionette lines and other pre-jowl lines. The laser aiming beam is easily visible through the skin. It is very important that care is taken to keep the laser tip moving at all times to avoid thermal injury to the skin. A total of 200 joules is delivered. The deeper layer of fat in the jowl is sculpted with the AccuSculpt laser by pinching the area to be lased. The laser fiber is passed in a continuous fashion using the preoperative topographical marking as the guide. The jowls lose the firmness to palpitation as the fat is liquefied. The transition from the jowl fat pad into the submalar fat is achieved with a feathering of the laser energy. A triport syringe 18-gauge aspirator is used to conservatively remove the emulsified fat as an aspirate.
Peg is now 12 days post-operative. She's had her first facial today. We applied a little makeup for the shooting. As we can see, she has a nice look to her. We're going to go through what we've done. We've done the malar lift, as we spoke about, which have lifted her cheeks back into position. We did the neck lift, which has given her a beautiful neck. And as we can see from the contour, we've achieved a 90-degree angle, and we've achieved a nice jawline. The laser has been used in the jowl region, as well as the marionette lines and the pre-jowl region. We used the AccuSculpt 1444 laser for lipolysis of the fat in the jowl itself, which allows some heating of the deep dermal elements as well as accommodation of the shape of the face from the removed fat. We have subcision of the marionette lines and the pre-jowl lines, which allows us to insert fat that was harvested from the neck to achieve a longer lasting elevation of the corner of the mouth and prevention of readhesion of the deep marionette lines. In this multimodality approach, I have found that the AccuLift procedure utilizing the AccuSculpt laser has allowed me to consistently improve the results in my treatment of the lower face. I've seen consistent improvement in the jawline with tightening of the skin, overlying the jowls, and elimination of the marionette lines. I've experienced great success utilizing this approach, and I'm confident you will too.